The weight loss surgery is a great option for most of the patients. It has been proved that it will improve your lifestyle, your way of life, looking, your self-esteem, your health, and it will help you, especially if you suffer with obesity, diabetes, and with high blood pressure. The weight loss surgery is a surgery that brings with itself a lot of factors, possibilities, results, and a lot of feelings. This is a surgery that involves a lot of physical, psychological, nutritionist, personal, and mental changes. And here's when it comes the most important thing. These changes won't be able to last a long-term goal if the patient doesn't put from their part, since it's a work team with the doctor that has a 10% which is the surgery and the patient which is the one that does the rest. To start off, it's important to mention the causes of obesity, which is the number one reason why people get the surgery. And according to Mayo Clinic, and I quote, although there are genetic, behavioral, metabolic, and hormonal influences on body weight, obesity occurs when you take in more calories than you burn through exercise and normal daily activities. Your body stores these excess calories as fat. Also, most American diets are too high in calories, often from the fast food and high calories beverages. People with obesity might eat more calories before being full, feel hungry sooner, or eat more due to stress and anxiety. And also, we need to take into account the genetics, the lifestyle, and the food addiction that one can develop. Talking about which type of weight loss surgery is best for you depends on the specific situation. Your surgery will take many factors into account, including body mass index, eating habits, other health issues, previous surgeries, and risk involved with each procedure. The surgery that you will be having doesn't depend on what the cost as the customer says, but on the doctor will be suggesting you, which is considered to be the best option.
There exist multiple options for weight loss surgery procedures. I will only be talking about the two most common ones. The first one is the gastric sleeve, which costs around $20,000. It's low risk, slow in losing weight, and you lose between 60% of the body weight in 12 months. The resulting pouch is about the size of a walnut and can hold only about an ounce of food. The second is the gastric bypass. This is one of the most common. This one costs around $25,000. The risk is moderate. The good thing is that the recovery is fast and the excess body weight that you lose between 60 to 80% in 12 months. About 80% of the stomach is removed. This smaller stomach can hold as much food. It also produces less of the appetite regulating hormone, which may decrease your desire to eat. Advantages to this procedure include significant weight loss.
It's a surgery, so as you know, it might exist some risk and complications. To be honest, the remaining obese might be more dangerous than having the surgery. Remaining obese is the second leading cause of premature death, while having the bariatric surgery is a very low risk procedure, and there's 99.9% of chances to survive, which is a high percentage. But some risk might be in the long and short term. This is why the importance of the preoperative diet, which consists in diet, necessary checkups of the doctor, and of course, no alcohol. According to Mayo Clinic, some of the common risks may associated during the procedure could be excessive bleeding, infection, adverse reaction to anesthesia, blood clots, leaks in the gastrointestinal system. The long-term risk could be as looking at them for us of complications prior on the surgery you decide to have. So it could be dumpling syndrome, hernias, low blood sugar, malnutrition, vomiting, acid reflux, and you will obviously need to have a second revision or a secondary surgery to correct some mistakes. Following the preoperative diet and steps is very important in order to have a safer surgery and important mental preparation, and it reduces the risk of gaining the weight back. The steps are before, during, and after. Of course, you will have checkups with the doctor, the nutritionist, and the psychologist. You need to prepare yourself and visit the doctors. Then you will have the procedure done. Then you will have to follow the diet and the post-operative. That is, it's now standing up, laying down, and take care of the wounds. Then the fourth step is the ingesting of only liquids, then slowly ingest vegetables and soups in slow portions. And the fifth one is the discharge by the decision of the doctor, and of course, start doing exercise as soon as possible. Continue your diet and visiting your nutritionist and psychologist. You need to remember that not only your body just went through change, it was also your mind. The most important thing to continue doing is changing your lifestyle, eating healthy, doing exercise. The ingestion of vitamin supplements is a very important thing that you will have to do for the rest of your life. Weight loss surgery is a very important surgery since it changes your lifestyle and helps you fix a lot of health changes. This could provide you a long-term weight loss, but how we mentioned it is a thing that depends on the patient and their goal. In keeping with the doctor's instructions, the amount of weight you lose can also be a vary depending on the surgery you get and how you adapt to your new life to the habits you need to build while you were through the process. It all depends on the loose goal weight that each person has, and this is a magnificent tool. In addition to this, you can also see improvements in your health by improving and resolving some medical conditions like heart disease, high blood pressure, obstructive sleep apnea, type 2 diabetes, non-alcoholic fatty liver disease, or non-alcoholic sleep diabetes, and osteoarthritis. We need to remember that the surgery depends on the patient, not only on the doctor. The steps you need to take before your weight loss surgery are 3 basic ones: a preparative, that is based on assisting the regular doctor checkups, also attending to a nutritionist and to a psychologist. They will be preparing you for what is coming. This is a drastic change in your body and mental health. This is a step the doctor will put you in some regulations just for you to follow and to see how capable you are of having the surgery done and not only being affected too much and pre-prepared for it, and the fact that you will be changing your lifestyle forever. The main difference between the successful and failed gastric sleeve patients is the successful patients which commit to the long-term diet and lifestyle changes, which is the goal of all the patients, but it all depends on the mental and how willing they are to change. This is a clear example. Her name is Vanessa Ortega. She just had positive things to say about the changes. As you can see, the picture on the right is how she was, and the one on the left is how she is now. She is a person of 26 years old. She was already becoming insulin resistant. She was having problems with the heart. Also, she was having beginnings of diabetic, and she was having difficulty to breathe. She was weighing about 95 kilograms, and nowadays she's 65 kilograms, and this is her goal weight. She is happy, her self-esteem is up to the sky. She hangs out with her friends again, and of course she feels better about her and her new lifestyle. Let's remember to go to change.org and sign the petition and support the cause for the restaurants to offer a special annual price for the customers that have the bariatric surgery, since they don't eat like all of the customers and they basically eat like a child.